Please come to order. Today's hearing is the second in a series of bipartisan hearings on the opioid crisis. Today we're focused on what is happening at the state and local levels to address this crisis that has touched families in every state. Senator Murray and I will have an opening statement, and then our members of this committee will introduce the witnesses. I will call on Senator Kane when I've completed my opening statement and ask him if he would like to make any opening remarks and introduce one of our witnesses. I thank him for being here. After the witnesses' testimony, senators will each have 5 minutes of questions. I mentioned to the witnesses that this subject is a subject of interest to every single senator on both sides of the political aisle. But we're in the midst of a tax debate today, and so senators will be coming and going. The toll of the opioid crisis that's ravaging our country is staggering. One of our witnesses today, Dr. Abu Bakr, has experienced the heartbreak that opioid addiction causes. His son, as a 17-year-old, was prescribed 90 Vicodin pills for a minor shoulder injury. He developed an addiction and overdosed 4 years later on a mixture of drugs, including heroin. I'm grateful that Dr. Abu Bakr is here to tell his family's heartbreaking story and share the work he's done to educate other doctors about prescribing opioids. As Dr. Abu Bakr has said, people from all walks of life have had problems. It's had nothing to do with where you live or where you came from. You could be the president, you could be the son of a doctor. Last month, this committee held the first in a series of hearings this Congress has had on the opioid crisis that is tearing our communities apart, tearing families apart, and posing an enormous challenge to healthcare providers and law enforcement officials. That hearing was focused on the federal response to the opioid crisis, and today we'll hear from those on the front lines. Our witnesses represent states, communities, and providers, and will share what they're doing and what, if any, changes are needed to federal law to fight the crisis. These witnesses come from 4 different states. They have personal and professional perspectives on the opioid crisis from the judicial and public health sectors. We hope to hold an additional hearing early next year as we build on our work from last Congress, which included passing the 21st Century Cures Act, appropriating $1 billion over 2 years for state grants, and the Comprehensive Addiction and Recovery Act, which created new programs to address this crisis. I mentioned some of the tragic statistics at our crisis, of this crisis at our last hearing, but they're worth repeating. The amount of opioids prescribed in the U.S. in 2015 was enough for every American to be medicated around the clock for 3 weeks, according to the Centers for Disease Control and Prevention. Across the country, 91 Americans die every day from an opioid overdose. In my home state of Tennessee, 1,631 Tennesseans died of a drug overdose last year, 12% more than the year before, mostly due to an increase in overdoses of synthetic opioids, including fentanyl, a pain medication that's 50 to 100 times stronger than morphine and can kill with just a small dose. It seems that every day there are new studies and statistics that further describe the toll of this crisis. For example, last week, the White House Office on Economic Advisors released a report that estimated the opioid crisis cost $504 billion in 2015. As we talk about this crisis from a state perspective, I hope to hear from our witnesses. How are different state departments, medical, public health, and judicial systems working together in a collaborative way to address this crisis? What innovative approaches are states taking to address the distinct challenges they face? For example, Rhode Island's working to connect individuals who overdose with recovery coaches while they receive treatment in hospital emergency departments to try to get people into treatment and break their cycle of addiction in the long term. The federal government remains an important partner in the opioid crisis. Earlier this month, the President's Commission on Combating Drug Addiction and the Opioid Crisis released recommendations, and I hope our witnesses will touch on some of those today. We also want to know what's being done with the tools and resources provided in the CARA Act and in the Cures Act, whether these laws are helping making progress, and if not, why not? This past spring, the administration began issuing grants funded by the Cures law for states to use in combating the opioid crisis. These totaled $485 million to all 50 states. Because each state is facing different challenges in responding to the crisis, it's important that states have flexibility in how to use the money. Tennessee, for example, received $14 million of that money. It's using the money to distribute naloxone, a drug that can reverse an overdose, and train people how to use it to reduce the number of overdose deaths, to expand access to medication-assisted treatment, to implement strategies to help reduce the number of babies born who experience withdrawal from opioids. In the last 10 years, Tennessee has seen a nearly tenfold rise in the incidence of babies born addicted to opioids. Other states are using the grants from cures to address different needs within their states. For example, Arkansas is using its grant to expand access to buprenorphine, a medication-assisted treatment. Other states are using funds to improve state-run prescription drug monitoring programs, the electronic databases that can track controlled substances prescribed by doctors and dispensed by pharmacists. That way, doctors can see whether a patient has been already prescribed an opioid by another doctor across the street. I'm eager to hear how these programs are run in your states and if there are things that can be done at the federal level to help improve coordination and data sharing at the state level. Now I would like to call on the senator from Virginia, Senator Kane, and invite him to make any remarks that he would like to make and to introduce our first witness. Then I will introduce the others.